you through the patents that are on Moderna's website. So there's a patent entitled Modified Polynucleotides for the Production of Secreted Proteins. This is one of the master patents for what they're calling mRNA vaccines. Right in the abstract, it describes that the lipid nanoparticles have a particle size between 80 and 160 nanometers, and it contains modified mRNA encoding a polypeptide. It includes a cationic lipid, a neutral lipid, a cholesterol, and a pegylated lipid. What they're calling lipids actually host cationic charges. They host positive electromagnetic fields. There is no lipid in nature that does that. They're using the term lipid instead of nanotechnology. As you go through the patent in section 219, it explains how they are self-assembled nanoparticles and they're fully programmable. That term in here is an alarming term for a number of reasons. One reason is that these are both pre-programmable as well as they can receive programs from an external source. Microsoft did a 3-minute video on their technology. They call them biological computers.
Really trying the programmable material.
DNA is highly programmable, just like a computer, and we can program a whole range of complex behaviors using DNA molecules.
So there's one specific patent that I think it's very important for every American citizen to see, and it's patent number US 9539210B2. It was issued on January 10th of 2017. The patent is entitled Vaccine Nanotechnology, and in section 9 it discusses the vaccine nanotechnology that can deliver molecules. In some embodiments, the small molecule is a toxin. The toxin is from a chemical weapon, an agent of biowarfare. This is a utility patent for the pegylated lipid nanoparticles that are in these, what they're calling COVID-19 vaccines. It is a utility patent for that nanotechnology to be used as a bioweapon. So Pfizer entered into a contract with the Department of Defense, the US Army, in July of 2020. And the contract was to manufacture a vaccine that was capable of providing protection against the SARS-CoV-2 threat and related coronaviruses. So the purpose was to create an mRNA vaccine that would protect against SARS-CoV-2 infection and the variants. As you go through this contract, though, under the Chemistry Manufacturing Control section, they go through the manufacturing process. Much of it is blacked out for the lipid nanoparticle formulation. They discuss how the lipid nanoparticles must adhere to good manufacturing practices, so they must not be contaminated. Well, in 2017, the FDA published guidance called Classification of Products as Drugs and Devices. And they classify nanoparticles. They classify them as devices because they can perform their functions inside the human body without being dependent on chemical reactions inside the human body. As you continue to go through the contract under the manufacturing development plan, that Pfizer will describe the manufacturing process for the vaccine product to ensure conformity with the Food and Drug Consumer Protection Act Title 21 351A2B. That's alarming because 21 U.S. Code 351A2B is the good manufacturing processes for devices. Specifically, the term device is an instrument, an apparatus, machine, or a contrivance that is intended to affect the structure of any function of the body of a man or other animal and does not achieve its primary purpose through chemical action within the body. So Pfizer has to adhere to the manufacturing practices for electromagnetic devices in their Operation Warp Speed contract. Nobody was told they were injected with electromagnetic devices.
Physicians from Comisov Worldwide in Mexico confronted their skepticism about the claims of any kind of electromagnetic properties of the vaccine and performed a series of tests. And their results were nothing short of horrifying.
Marzo-abril del 2021 empezamos a detectar magnetismo en el sitio de inoculación de las vacunas. Ese fue el primer hallazgo. Después, compañeros de los vacunados que no estaban vacunados empezaron a decir que también ellos tenían magnetismo en alguna parte de su cuerpo. Ante esa evidencia nos hicimos de un medidor de frecuencias electromagnéticas y entonces empezamos a medir la radiofrecuencia del vacunado y del no vacunado. Nos llamó la atención que no nada más había un fenómeno magnético, sino que también estaban funcionando como una gran antena. Una antena que estaba recibiendo algún tipo de señal. Llegó a nosotros un estudio de un doctor llamado Pablo Campra de la Universidad de Almería. Y por ahí de junio del 2021 llegó a nosotros el primer estudio de grafeno en una vacuna Pfizer. Yo, como médico, jamás había oído hablar del grafeno ni sabía qué era. Me puse a investigar y es un derivado del carbono que tiene propiedades magnéticas una vez que ingresa al cuerpo. Fuera del cuerpo, en un vial de una vacuna, no es magnético. Aparentemente, cuando el grafeno entra al interior del organismo y cambia de temperatura, reacciona con el hidrógeno del agua corporal y ahí es donde forma hidróxido de grafeno y se magnetiza. El siguiente hallazgo fue en noviembre del año pasado, en donde no nada más se detecta grafeno en la vacuna Pfizer, sino se detecta en AstraZeneca, Moderna y Johnson & Johnson, detectado por microscopía electrónica. Después nos vamos enterando que en Estados Unidos el Dr. Robert Young también hace microscopía electrónica en viales de vacuna. Y en enero más o menos de este año llega a nuestro conocimiento el estudio de viales de vacuna CanSino, Sputnik y Sinopharm, que también tienen óxido de grafeno. El 100% de los viales que se estudiaron tienen óxido de grafeno.
First interview with Stu Peters, I disclosed the manufacturing facilities in China that were creating all of the excipients for all of the COVID-19 injections around the globe, including Pfizer's ALC0135 and ALC0159. And when you went to their website and you looked at their formulation for these excipients, they had publications on there explaining how they contained graphene oxide. And although that interview has gotten well over tens of millions of views around the globe, I was immediately attacked by the mainstream media saying that there was no evidence that there was graphene oxide in the injections.
False reports online state that some COVID-19 vaccines are 99% graphene oxide.
One claim that's popped up recently is about graphene-like structures in the shot.
A Maine CDC spokesperson called the claim false and ridiculous.
This has not been verified. It's not a peer-reviewed journal. There is no substance here of accountability to the person who's published this.
No, the COVID-19 vaccines do not contain any graphene oxide or other harmful materials.
We are being gaslit and being told that there is no nanotechnology and there is no graphene oxide in these injections. Pfizer's own internal documents, and they have a peer-reviewed publication explaining how they use graphene oxide in the engineering of these nanoparticle technologies and their spike proteins. And when you read through the document, they explain how they order sequences from Syn Biological, infect human embryonic kidney cells, pour that fluid, that purified protein fluid, because now after they infect the human embryonic kidney cells, those kidney cells produce these new multi-species proteins that have genetic sequences from non-human DNA. They pour it over a gold quantifoil mesh grids and overlay it with one atom thick layer of graphene oxide. They create electromagnetic fields that then disrupt the electrons of all of these materials, both organic and inorganic, and new ionic bonds are created. Those new ionic bonds then create millions of what they're calling spike proteins, which are these new artificial pathogens. Scientists and doctors around the globe have started to take a look at what's in the vials underneath the microscope, and Dr. Anna Mahalsia out of Washington State has been pioneering an effort to do this globally, and her and her colleagues have found and observed electromagnetic devices underneath the microscope, and they've seen the technology begin to self-assemble. Engineers have been looking at the vials, the fluid in the vials underneath an electron microscope, brought in cell phones to see if there's a reaction. And what they found is that when the fluid that's in the vials is near electromagnetic frequencies, whether they're from smartphones or smart towers in a house, it activates this technology. They also talk about in this patent in section 219 is the gels and the hydrogels. And it says mRNA disclosed herein may be encapsulated into any hydrogel known in the art, which may form a gel when injected into the subject. And hydrogel is comprised of single atom thick graphene oxides. So in Died Suddenly, when you see those long, thin, white fibrous clots, those are the product of magnetic smart hydrogel. They're called soft actuators. They mimic cells and proteins to the point that they can actually start building structures in the human body, tissue structures, anatomical structures. They can recreate entire systems and organs. And hydrogel is comprised of single atom thick graphene oxide. What you're also going to be seeing, though, is you're going to be hearing the benefits of graphene oxide. The mainstream media is going to say, oh, graphene oxide has these amazing bactericidal effects, meaning it kills bacteria. It has amazing antiviral effects. These are things that you're going to hear about graphene oxide. These are lies. Graphene oxide can be as thin as a single atom thick. But it's also a great conductor of electromagnetic fields. When it's been merged with these non-human proteins that Pfizer did in Groton, Connecticut, and they merged graphene oxide, an electromagnetic conductor, with proteins, biological proteins, and they create these new synthetic agents, they're called transducers. That means they can change the electromagnetic field inside the human body. Graphene oxide is being used because of its great electromagnetic properties. This is not conspiracy theory, and people are hosting electromagnetic fields. We have people who are able to put magnets to themselves. They're emitting Bluetooth signals.
Pero, ¿por qué a campo abierto? Obviamente desconocemos dónde están las personas que fallecieron en 2021 y 2022 y nos estamos guiando por las lecturas de Bluetooth. Repito, estamos en un cementerio, aquí alrededor no hay nadie vivo a la redonda. Aquí, nuevamente, otro dispositivo Bluetooth más de una persona que falleció el 22 de noviembre del 2021. Ya están 11 dispositivos aquí registrados y ahí están los códigos MAC.
About the directed evolution and controlling the evolution of the human species. Directed evolution is transhumanism. Transhumanism, if you're forcing non-human genetic mutations to our genome, you are exterminating the human species.
It was actually described as a bioweapons platform technology in 2005. And from 2005 onwards, it was actually a biowarfare enabling agent, its official classification from 2005 forward. I don't know if that sounds like public health to you. Does it? Biological warfare enabling technology. That feels like not public health. That feels like not medicine. That feels like a weapon.